common endocrine-related emergencies that are not diabetic ketoacidosis would include things like addisonian crisis. That's probably the next most common one I can think of. That is generally a problem of dogs, and oftentimes those animals present in hypovolemic shock with pretty significant bradycardia and altered mental status, many times having quite a lot of gastrointestinal signs. The thing that's tough about Addison's disease is how vague the history can be and how many other disease processes it mimics, as well as how many other processes look like it. So there can be a lot of confusion, even if Addison's disease is fairly high in your mind as far as when you see a case. It can take sometimes a while to sort out whether you're dealing with an Addisonian or, for instance, an animal who's had a lot of urine and, say, gastrointestinal losses secondary to acute kidney injury or kidney failure. And so sorting those things out over time can be challenging. So I would say that's one of the main challenges about Addison's disease, is remember to keep it in mind for things as a rule out for problems that like vomiting and diarrhea and just not feeling good, poor appetite, lethargy, things like that, where many other problems are far more common that cause those symptoms. Other endocrine emergencies include another topic that we discussed here at Atlantic Coast Veterinary Conference was Thyroid Storm. Thyroid Storm is actually, we don't know how common it is. It is a problem that we would see in cats with hyperthyroidism and is associated with elevated levels of thyroid hormone in the blood, and has a vague description because it's never really properly been documented in cats. It is a syndrome that's recognized in people, and we do think that hyperthyroid cats also probably get it. It involves elevated rectal temperature, gastrointestinal signs, oftentimes some liver abnormalities, many times profound weakness associated with hypoglycemia, so many times they have cervical ventriflexion or a dropped head. They can have cardiovascular disturbance, hypertension. They can just have a laundry list of abnormalities, basically. And I think it's possible that we are seeing thyroid storm in the emergency room and intensive care unit, and that we may under-recognize it. Those signs, at least some thereof, have to be seen in concert with an elevated thyroid hormone level to confirm that it really is a thyroid storm you're seeing. Other endocrine emergencies that we actually did not touch on here at Atlantic Coast Veterinary Conference would be things like insulinoma, which most commonly presents with clinical signs of hypoglycemia, sometimes profound. So sometimes animals are experiencing seizures, and many times that will be the presenting complaint to the emergency room in an animal with an insulinoma. So anytime we see unexplained hypoglycemia in a usually at least middle-aged or older pet, insulinoma should be very high on the list of possibilities. And finally, myxedema coma, which is a very uncommon, very uncommon, life-threatening complication of hypothyroidism seen in dogs, particularly in cold weather times.